Greetings to all viewers. I would like to speak today on PCOS, a very common topic which is troubling the minds of many women, young and some old. And a lot of misconceptions and conceptions have been there on this topic. And I would like to remove as many misconceptions as possible, with some directions on how to handle this very common problem that is there in modern day society. I'm Dr. Shobana Mohandas, from a gynecologist from Thrissur. What is PCOS? In a normal woman, many follicles try to grow, but only one grows into a dominant follicle. Whereas on the right side, you can say in a PCOS woman, PCOD woman, whichever, lot of follicles try to grow and no follicle becomes dominant. It's like too many cooks will spoil the broth, so all the follicles will start producing hormones, which will get converted to male hormones, and these male hormones create a havoc in the woman. And they manifest with irregular periods, hirsutism, acne, and darkening skin called acanthosis nigricans, etc. So just a diagnosis of ultrasound showing multicystic appearance is not PC. Only if any two of these criteria are there, then only you can call it PCOD. Because in young women of 20 to 25, there are many follicles are trying to grow out, and they may give an appearance of PCOD, but it's not really PCOD. So you have to have hirsutism, acne, or irregular periods along with some ultrasound diagnosis. Then you can call it PCOD. And what is it basically? It's a younger sister of diabetes. There is a lot of insulin in the body, and this insulin is created because the sugar does not enter the cells. There is a resistance to the insulin at the cellular level. So, lot of insulin is not allowed to act on other cells, but they do act on the ovary. And on the ovary, they help to create a lot of male hormones. And male hormones are not good for the body. Basically, when you eat a lot of junk food, a lot of sweets, a lot of insulin is created, and this insulin will create sugar, will not be allowed to act, and these sugars are converted into fat. And the sugars also cause inflammation, so you will get arthritis, frequent illnesses, and so on and so forth. So too much sugar in the body is not good, and this sugar is created because the insulin is not allowed to act. So there is a condition of insulin resistance. Basically, PCOD causes obesity, and obesity in turn causes PCOD. It's a vicious cycle. In PCOD, there is a sex hormone imbalance which leads to fat accumulation. The fat accumulation by itself causes insulin resistance, and that resistance causes more insulin in the body, and more insulin causes more hormones. Again, the imbalance causes fat. So it's a vicious cycle. So PCOD patients come and say, I don't eat much, but I am fat because of PCOD. She is right. But this vicious cycle can not be broken by the tendency to put on, insulin resistance by the body. What we can break is the obesity part of it, because that is in our hands. So the answer may be in breaking the obesity part, because that's what we can do. So what can be done? One is lifestyle modifications. Without lifestyle modifications and a reduction in weight, whatever medical treatment can be given will not act. It will be like throwing a stone against a wall. It won't penetrate it. So you have to have some amount of lifestyle modification. PCOD can happen in young, thin women also. There, all the factors which are necessary to decrease weight that we talk of in obese women is not actually necessary in these women. But in obese women, you have to have a lot of exercise and a lot of diet modifications, which will also reduce the weight. And when the corona was there, a lot of people were sitting at home and they used to become fat, and that led to a lot of obesity. Again, entrance exam is a time when the active young girls are forced to sit and study for a long time, drinking tea and juice, and they grow fat and they become PCOD patients. Excessive intake of sweets for any reason, any celebration, too much celebration can all give PCOD. Sudden rest after marriage, or your sedentary job, suddenly when you are having to do that after an active period before that, there again you can have PCOD. So anything that leads you to put on weight can have PCOD as a consequences. I told you that sugars cause insulin resistance. If there is a tendency for the body to have resistance to insulin. So boiled potatoes, white rice, aerated drinks, watermelon, all this are easily absorbed carbohydrates, which will increase the glycemic index. All these foods have high glycemic index, meaning these sugars can be easily absorbed by the body. So when these high glycemic index foods are there, it will increase insulin levels, and we know that insulin will cause male hormones and PCOD. Even vegetables like pumpkin, bread, maida, cornflakes, cake, nankatais, chocolates, Indian sweets, all these have high glycemic index, meaning the tendency to form easily absorbable sugars. And that will lead to insulin resistance and again PCOS. So what we can do is reduce the amount of rice, or you can convert it into chapatis and add a lot of vegetables, sabjis, or your chanas or fish. Decrease the amount of carbohydrates, not bring it to zero, but decrease it and substitute it with other foods which have low glycemic index. So, because otherwise you will get famished if you just don't eat, and then there will be irregular eating. So, you eat on time, but reduce the foods with uh, high glycemic index, substitute them with foods with low glycemic index. Again, how can you reduce the amount of aerated drinks which contain a lot of sugar and therefore high glycemic index? So try to take green tea or your lemonade or cucumber juice, spice it up with a little pudina or ginger, mint, lemon, all this can be added to the cucumber juice, and then it will become an interesting drink that can substitute your aerated drinks. Almond milk is low glycemic index, tomato juice, your coconut water, all these things can substitute your aerated drinks, and that will reduce the glycemic index of the foods you take. You can substitute fruits like pineapple, dates, and watermelon with apple, guava, orange, papaya, which are easily available in the Indian market. Again, you should avoid fats, especially trans fatty acids, because they are more dangerous and they are more uh, available in vanaspati. They increase the bad cholesterol, decrease the good cholesterol, which is HDL cholesterol. And so all this increase in bad cholesterol can lead to PCOD. So you have to avoid nankatais, vanaspatis, samosas, burgers. All these things are boiled made in vanaspati that contains trans fatty acids. Another thing is eating from outside and eating junk food, because basically all the restaurants or street joints, they use oil from morning to evening. And if you use an oil which has been reused more than 3 times, the trans fatty acid content will increase, and that I told you can increase PCOD. So again, high fat diet has to be reduced, and this obesity which has been caused has to be reduced, not only by reducing the high glycemic index, but also reducing the fat content of the body. That can be done with exercise, which is good not only to reduce the lipids, it reduces anxiety, lowers testosterone, improves the insulin resistance. So, overall, not only by reducing weight, even by other means, exercise is definitely beneficial for a PCOD patient. Best thing, easiest thing is to walk for long times and brisk walking where you can sweat. Yoga trained under a good trainer can, for 15 minutes, also reduce weight. So cardiovascular exercise is another thing where can do cycling, running, or swimming, and it will really burn your fat and improve your heart. 30 minutes of moderate intensity exercise for 5 times a week can reduce PCOS. Fat loss can also be achieved by weight training, strength, which will give strength to the muscles, and that can be done probably 2 times a week under a good gymnast teacher. A lot of patients come and say, I don't eat anything, but I put on weight. You should see, I don't eat anything. I don't eat breakfast. I rush off. But when you closely question them, you realize they eat laddus or drinks or they eat sweets. If you go to see, if you take just one besan laddu, if you want to burn out the calories in that besan laddu, you have to run for 30 minutes at 11 kilometers per hour. You have to cycle for 41 minutes to burn out one laddu, or you have to swim for 53 minutes to burn out one laddu. So you can imagine what that one laddu is doing damage to you while you say you're not eating anything. Again, if you just drink one Pepsi can, you will imbibe 139 calories, which is more than double amount of 2 breakfasts with 2 idlis of chutney. Even 2 idlis, if you want to burn out, you have to do 10 minutes of cycling or 15 minutes, 20 minutes of running or 25 minutes of cleaning your house. So each food is so easy to eat, but so difficult to burn out. And so eat wisely. Even a small little chocolate, 7-gram chocolate contains 37 calories. You eat 2 chocolates and it's more than 2 idlis. So to burn it out, you have to work out a lot. So one chocolate won't do you any harm. And people ask you to celebrate their birthdays and everything with chocolates. And all the dieting that you do by not eating at lunch and dinner will go out. So just put it in your pocket and give it to somebody else. What you can eat. That is beans, broccoli, chana, white rice to some extent, not much, reduce the amount. Brown rice is better. And tomato juice and things like that. Milk, earlier we used to think all milk products are not good for PCOD, but now they say low fat milk products like your buttermilk or without fat or even your milk is not harmful. Fatty ones like cream and cheese and things like that, that can be really bad for you and can cause PCOD. The vegetables like sprouted beans, broccoli. You know why I show the yellow cabbage is because that can be eaten raw. Green cabbage has to be boiled. Cauliflower has to be boiled. Lettuce, cucumber, brinjal, mushrooms, capsicum, celery, tomatoes, onions. All this should be included more in your diet, preferably raw or just little bit boiled, and reduce the amount of carbohydrates. If you are a non-vegetarian, you can use salmon, herring, codfish, mackerel, rainbow trout, or tuna. Basically, because all these fishes are very rich in omega-3 fatty acids, and omega-3 fatty acids are good to reduce PCOS. Even lean red meat without the fat content, or the lean chicken or duck, poultry, all this is substituting carbohydrates with all this can be good. Now, besides the basic food, almonds, pumpkin seeds, sunflower seeds, sesame seeds, or even your khaskhas or poppy seeds, all these are uh, factors, things that can reduce the PCOD. Now, licorice is available in Indian market. About half spoon per day, quarter spoon per day can reduce androgenism. Fenugreek, methi, you soak 1 teaspoon in 1 glass of water overnight and boil it next day and drink the water. That can reduce PCOD because it can decrease the insulin resistance. And even cinnamon, which is used commonly in biryanis, half to 1 spoon per day can be useful to reduce PCOD. I know you can't eat all of it at one go, but some of it daily, here, there, if you incorporate that into your diet, it will be helpful in reducing the PCOD. Besides all the food and the exercise, the doctors will prescribe metformin, myoinositol, decaioinositol, even atorvastatin, which is normally used for cholesterol, and even melatonin. There are many new drugs which have come which are useful for reducing insulin resistance. If all that doesn't work, puncturing the ovaries laparoscopically can help. I used to do a lot of the surgery earlier when these drugs were not very common. But now, this decade, a lot of drugs have come, and I hardly ever need to do a PCOD puncture through the laparoscope for PCOD patients anymore. So, basically, lifestyle modifications help in the treatment of PCOD, and medicines can also. Thank you for your patient listening, and I hope you had a lot of knowledge coming through this session. Thank you for your